I want to take just a few minutes and talk a little bit about the issue of work. Last year we talked about how to fill out the disability application process, and it's a really long process, and it's typical to America. So I thought for this year we might talk a little bit about just the overall notion of whether or not to work. How does ECD affect work? So I'm going to talk a little bit about how we assess functional changes, whether we decide to work or not, what are some of the criteria you might use, and then what are sources of financial support. So when we look at function, you know, you've all been talking over the last couple of days about what changes you've lost and things that are, you know, much more difficult. So I think the way to look at function is to try to think if there's any early warning signs. Are you starting to see some small changes that are affecting how you might work? Keeping up to date, pacing with the work, meeting deadlines, that kind of stuff. The other piece is looking at how severe your symptoms are. If they're really severe, it's probably not a good idea to head into work. You don't want to hurt yourself. And then the effect of your illness on mobility, endurance, your thinking, interaction with other people, all those things affect what happens at work. Now let me see if I can find this next one here. Yeah. I'm going to move that to the side. All right, so to work or not. The first thing you need to do, I think, is figure out what your criteria are. How are you going to know when you can stay working? How can you know when it's really time to change and take less demands in your life? This requires ruthless self-honesty. It's not criticism, it's just saying, here's where I am today, and trying to figure out what would be best and in your best interest. The issue, bottom line issue, is quality of life, making sure that you're leading your life in a way that feels good. So how are you going to evaluate your work performance? One way to do it is look at what's essentially required on the job. What do you really have to do? And see if you're able to do those things, even if you use accommodations. So what about working works for you, and what makes your symptoms worse? That's the main question. Some people ask for accommodations before they stop working, and these are just a couple of examples. Maybe temperature is difficult and bothersome, so you can ask for a heater or a fan, something to change the temperature. Fatigue. I heard a lot about people talking about fatigue, so are there any things that would make your time at work less fatiguing? Can you sit more? Can you have an ergonomic workstation? Could you have less walking from one part of the building to the other? Some people get terrible headaches, so is there anything about lighting that could be changed to allow you to work better? There's something in America called the Job Accommodation Network, and it's on the internet. I put the citation here, and these slides are going to be on for the ECD, and I don't know if you put them up on the website, but they'll be available. But you can ask for some sort of workplace accommodation that phases in. So you're not taking all the accommodations at once. You're sort of trying, trial and error, what seems to work to enable you to keep a job. What happens, though, when those accommodations don't work anymore and suddenly you're faced with too many problems working? You have to figure out what's next. What am I going to do? If I don't work, what am I going to do? So without work, income is a problem. So what are some different ways that you might complement or change your income? Some people go right into their savings or their retirement savings. And this is sort of scary because you wonder how long that's all going to last, you know, depending on how much money you have and how old you are. So sometimes it's helpful to look at other sources of financial support. A lot of people have workers have some sort of long-term and short-term disability programs. So that's a really good thing to check out before you need it. So see if you are working, what are their policies. If you move to the long-term disability policy, you do have to apply for Social Security disability, the federal program. And then unemployment insurance can be a way to sort of bridge the gap between not being able to work and perhaps a health treatment that you're in. So in the employer's disability, the short term is usually 3 to 6 months, but it means you're going to go back to work. Long-term disability means you really can't go back to work, and you ask for either total or partial disability. At that time, the companies often want you to apply for Social Security because that's something you're entitled to. So they want to make sure you have what you're having from the federal government, and then they complement it. Everything varies, so the whole thing is to try to figure out what your particular system requires. Social Security disability, it's in the United States, and it's a federal insurance program. When we're working, we all contribute to it. So those taxes that are taken out every paycheck, they're for people who are going to be disabled or for our long-term retirement. What you're essentially asking the government is, may I please use my retirement money early? It's not a gift, and it doesn't depend on how much money you have in the bank. So Social Security disability is something we're all entitled to. And what they want to know is, are you going to be out of work for a year? Or have you been? Okay, is this a significant illness that's going to impact it severe enough to impact your ability to work? So you have to get medical documentation. So make sure when you're talking to your doctors that you're talking about function, how it affects your daytime. Can you stand up to do the dishes? Do you have trouble sleeping? You know, what are things that are physically difficult for you, emotionally difficult? Because once that's in the medical record, then when they send the medical records in support of your application, that kind of functional information will be there. As people with ECD, you're allowed to ask for expedited review. That means typically it takes 5-6 months for Social Security to look through the whole application. And what you're trying for expedited review is to try to make that process quicker. So when you put on your application, it's done online. If you put it in and you say in the remarks section, I have ECD, I request expedited review, that means make it faster. That would be important to follow up on too. So when you think about the types of impairments, it's really 4 areas: daily living, social functioning, concentration, pacing, and persistence. Can you keep up with the pace of work? Can you meet the demands? Can you stick to it? Do you need really long breaks? What's happening in terms of sort of getting through the job? And are there periods that your illness isn't as good? Okay? It's really fine here and you can work, but then there's times that you can't. That inability to maintain stable employment can be an issue to discuss with Social Security. Now the other thing is, how do they define work? Because you can be working and apply for Social Security. You just can't be earning gobs of money, okay? So if you're working and earning $780 a month or less, you can do that any month and still apply for disability and receive disability. That's called below substantial gainful activity. Big words. They set every year a certain amount of money for what's the definition of work. This year it's earning $1,090 a month. But you can earn up to $780 and still be eligible to apply for disability. Every year they change that amount, and they show it on the website. So if any of you have gone through this process, it's really complex. You go on to socialsecurity.gov and you start filling out the application. It says disability, apply for disability benefits, and there's just page after page of reports that you need to fill out. It's very complex, and it's helpful to have somebody to do it with you. Okay, make sure you're gathering all your medical information, all your work history, and doing enough to provide enough data for Social Security. Everything's confidential, just like a doctor's medical report. It's confidential, so what you put into Social Security isn't supposed to follow you anywhere else. So it's okay to say what's really happening. If you provide more detail than you possibly think you need, that's going to help. Okay, because they're trying to get under your skin. They're trying to see, what does it feel like and what does it mean to have your health condition? If you ask for help, that's really good. It's ask for the help you need. There's a national 800 number. So you're working with your local Social Security office, but you can also call up that 800 number and be sure you keep your record up to date there. The list of local offices, if you don't know where it is on the website. You can ask for lawyers or legal firms to help you, social workers, case managers. Sometimes the employer's human resource department will help if you're on a disability program from work. So when you look at this whole process of to work or not, the biggest challenge is recognizing when you do need help, okay, and when you don't. So you also have to describe things that are embarrassing, okay? So you have to put down some of the finer details about what happens with bathing, dressing, grooming, getting ready for work, using the toilet at work, whatever it might be. So sometimes it's embarrassing, but it's worth it to detail those things. What you want to do is give examples of what's severely impaired. You might have better days, but you put that in remarks. The worst thing is what you want to present in there, and be very specific. The bottom line for all of us is we have to take good care of ourselves in life. That's what we all do. And I don't mean bathing, grooming. I mean care of the self, of our whole person. So taking good care of yourself can take many forms, and this is one of them. Financial stability can reduce the amount of stress that you're feeling, therefore it can help your symptoms. And if overall health care is our real goal, then it's worth asking for help. Okay, if you need to get in touch with me, that's my email at NIH, and I hope this sort of gave a perspective on determining whether to work or not to work. Thank you.
Thank you, Dr. Robinson. We really appreciate that. Robertson, sorry.
That's all right.
Are there any questions for Dr. Robertson?
I was about to scream, but I'm glad I got the microphone now. How far back can you go for applying for disability?
So you have to have worked 5 of the last 10 years. So if you look at your work history, you want to make sure you're applying soon after you stop working. If you wait till the 5 years, then your application timing is off. If you get, just a few months before you're going to miss that 5-year mark, they don't have enough time to review it. So it's a pretty good idea to, if you think you're not going to be able to work, put it in. If you go back to work, they love it, and you get incentives to go back to work.
Our issue is slightly different.
Uh-huh.
We lose all of our health care benefits when we become eligible for the government program, so we're going to stay on. But if there's a window between when he's automatically going to be kicked off our insurance and then we can go back and get some of the...
So it's your health insurance that's doing that, or your employer's...
The employer's health insurance.
Employer's
the
disability
company,
insurance.
Yeah. No, not disability insurance, health insurance, just health care.
Employee's health insurance. So does your employer have a disability program?
He retired before we found out he had the disease.
So if you're still taking their health insurance, then you're saying you're sort of have to follow their rules.
Correct.
Right. Well, when the time comes, be sure you go back and say his date of onset. What they'll say is date last worked.
Right.
And that's what you need.
So I need to be at 4.5 years.
Yeah. Yeah.
And then hopefully get the money in before the insurance runs out and then the federal program kicks in.
Exactly.
Thank
you got
you.
it.
Do you have any idea
Where are you?
can you get a
Thank
sense
you.
of how many people with ECD have successfully applied for Social Security disability, actually gotten it? Do you have any idea about that?
I don't have an idea of a number, but I do know that people that I've worked with at NIH have done fine.
Okay.
Yeah.
Thank you.
So sometimes people come and I can help go through the process about what's required and think about the language and describing things that are hard. And then people will put that onto the application on the internet. Yes?
All right. We have been self-employed our majority of our married life. She worked for the company, but we took it as draws. And she made good money. We had to go back in 13 and redo some things to be able to get the numbers that we needed to get her for disability. So we showed as she worked for 6 months. Then 6 months later, went in the hospital and all went. We've gotten 2 denials. We showed that she did go back to work. Is it harder because you're self-employed versus she would have been employed by someone? It just seems like they go right up to the very end on everything. It's 10 weeks, and it's 10 weeks to the day when they notify you. So finally, we hired an attorney, which is insane.
It'll cost a little bit of whatever back payment you might get, right?
And like he said, we're not even guaranteed back pay.
Right. So the issue with self-employment is they do give disability to people with self-employment. The issue when you're filling it in is you have to record every single month what income you had, what expenses you had, and that's different than people who are applying with a salary. I don't think the issue of denial is about the form of income. It's about the severity of disability. So you have to talk about very detailed things about eating, cooking for yourself, standing, sitting, okay, doing all those physical things, plus if there's anything with depression or cognition, anything else that's changed. Because they're trying to see if you could do any other kind of work. If you can't do any other kind of work, that's when they give it. So you have to show that there's the whole breadth of functional loss. So that's what I was mentioning, physical, social, cognitive, and emotional. So if there's any, experience of depression or anything in there that's been treated, that's all those things are important to put in.
So the other question I have then is that as you watch somebody that walks in and has a back pain, has it fused, can still physically work, gets disability like that, and then you see what we're going through, other people, I've talked to other people about this, where's the logic in that? What reject from the car wash did that guy get that could still work and he's getting disability? I don't get it.
So one of the things we even talked about this morning in the patient group is people can look at someone else and think they aren't impaired. So to look at somebody is really tough to make a judgment. There might be other things that are going on that we don't know. So fatigue is one of the things that people experience a lot. So expressing exactly how fatigued a person gets. Does somebody get tired brushing their teeth and they have to sit down? Do they get tired eating? Okay, whatever it is. So to look at other people's cases isn't as helpful as saying, how can you describe your own case more specifically? Each state has a disability determination office, and those doctors in that office are the ones that make the decision. So Social Security doesn't really do it. They hire out, they contract out to this state agency in each state. It is a compassionate. So if you, yeah, it should be something that gets you through quicker. Did you put that on the application? So well, let me get at your address and see if I can send you some things, because the compassionate review is fairly recent. It's not within the last month, okay, but it's fairly recent. So they weren't using that criteria a while back. Yes. Is it time? Not yet. Okay. Go ahead.
My daughter recently just got SSI. She struggled. She did apply twice to get it, and she got turned down. She was trying to work, and it just wasn't working out for her.
Right.
And we were told she needed a lawyer. We did get a lawyer. The lawyer said, if I don't take a case that I can't win, so I'm not going to take your case. So then finally, she couldn't take work anymore. She quit working, so I called the lawyer back, and I said, what, can you just meet with us? I went and met with her, and she looked at my daughter, and my daughter couldn't sit still in the chair, and she says, you got a problem? What's wrong? Why can't you just sit still? And she says, I have this disease, and I can't sit still ever. I have to get up in school, everywhere. So the lawyer looked at her, and she says, I'm taking your case.
Good.
But it helped because she got information from Dr. Strada, all her doctors at the University
Absolutely.
of Chicago,
Yeah.
plus the ECD article. All of that helped, but it was a fight, because even in this place they had a doctor in there looking at her and looked at her and said, yeah, she's got problems. She needs to get it.
Mm-hmm. I think what you really pointed out was keep going. Okay, even if you get the first rejection, keep going. The first appeal is, within 30 days, and then it gets reviewed within that disability determination office, then by a judge. And often by the time that people see a judge, the judge can look at the whole case and have a better view of it. Also, the second thing you said was medical documentation. You have to make sure that your doctors are putting in a medical report. Sometimes people only send in a copy of their scratchy notes. So if you look on the disability website, there's a spot where it says consultative exam. And that's all the things that they want doctors to report. So you can help your doctor by pulling all that information together as much as you have. Plus, you're allowed to send in whatever medical documents you have yourself. Congratulations. It only took a year, right? Yes.
So I just wanted to sort of piggyback off of what this gentleman was saying, because we've had a very similar experience.
Mm-hmm.
And my wife was denied the first time we changed lawyers. We filed a new claim. We appealed, and we just I'm fast forwarding through a lot. Obviously, she's been through in front of a administrative law judge twice now. And we just waited 18 months to get a letter saying we're not going to look at your appeal.
The next case is your representative, your congressperson, because this is a federal program. So I've heard some people go to their congressperson and say, I need help with this. And the other thing would be to emphasize ECD and give an article and, information about that. I'm so sorry this has been hard for you.
And I think the tricky part with her is that she has improved, and she's not in a wheelchair, thank God, like some other folks, and so she looks well. But her function is, by definition, and I've done my research, she can't work.
Right.
But they don't seem to care about that. They basically have said she's lying, is what they've said. I mean,
Well,
that's if you read the reports.
That means your doctors have to corroborate what she's saying. So that means the doctor has to hear what she's experiencing. And that's not what doctors ask us. They're asking us about our symptoms, not how we're functioning. So we have to try to slip that in, so it becomes part of the medical report. Some people even give something to the doctor each time they go, so there's something in writing. I'm seeing the axe here. Thank you.
Thank you very much. We really appreciate you, Dr.